Hi, ladies. We are here today to announce a very exciting partnership and let's introduce ourselves to this audience. So, I'm Kelly Springer, registered dietitian, owner of Kelly's Choice. And go ahead, Hannah, kick it off.
All right, I'm Hannah Denson. I'm with VerusRx. We are a PBM, and I'm the Market Vice President of Sales for Verus.
And I'm Kaylen Sheridan. I am one of the clinical pharmacists that we have on staff at Verus.
So, this partnership came about a year ago, and we're announcing it today because all of the powers that be came together to understand that pharmacy should go along with nutrition. 100% agree with that. But when I first met Hannah, she was a little girl and she grew up to this beautiful woman. And she said, Kelly, I'm working for a PBM. And I said, I have no idea what that is. So, will you explain what a PBM is?
I will. So, PBM is a pharmacy benefit manager. That's what it stands for. And what we do is manage pharmacy networks, negotiate pharmacy drug pricing with the pharmacies, and then process the claims. So, to make it a little sound simpler, is when you go to the pharmacy and you're picking up your medication, we're that insurance piece in the background. But Verus really takes it a step further by putting in cost containment programs, going past the basics and putting in cost containment programs that will drive down the cost for the members when they're at the point of sale or minimize it entirely, but also benefit the employer sponsored health plan that is providing those benefits to those members. So we take a really strategic approach in putting in cost containment programs, which we have called Verus Path. And then adding Kelly's Choice in, which is really the key piece, is getting people healthier because these medications are not meant to cure anything most of the time. They're there to manage a disease that is long term or a forever disease.
That was a perfect way to say it. So basically, everybody wins from the employer to the employee. The whole system kind of comes together in that way. And I was blown away that there's different PBMs out there that are tied in with insurance companies. So they may not be giving you the best price. So that was something I was learning and still learning today. And I think a lot of employer groups are learning it. So, Kaylin, you're coming in as the pharmacist. Tell me how the pharmacist works with the PBM. How does this work?
Sure. It's a very non-traditional role for a pharmacist. After graduating pharmacy school, I went straight into a residency program where I thought I was going to spend my career in chronic disease state management. So in that
Mhm.
year, we did training on working with these patients who had diabetes, had um, hypertension, had high cholesterol. And I saw myself being that, for the next 30, 40 years. But instead, I'm at Verus. So instead, I'm a pharmacist at a PBM. And I don't think many people know what that looks like. Even my mom, sometimes I'm trying to explain to her, and she's like, I just don't know what you do. And that's fine. When you picture a pharmacist, you're probably thinking, what, like someone who
Standing behind
stands
the
by the counter, yeah,
counter.
someone in a
Yeah.
white coat dispensing medication that the prescribers have given you. I've done that
Mhm.
before too. I have experience doing that. And I think that was important. Perspective to have, so I know what it's like. You mentioned drug costs.
Mhm.
I know what it's like to have those conversations with a patient at the counter who can't afford their copay
Mhm.
or has to change medications because their insurance prefers one over the other. So I have that perspective, and then the chronic disease state management I had with residency program. Now I'm using that all together at the PBM from the other side of it. Um, so we help to manage costs, like Hannah said, set the formulary for these drugs to know, which one is going to be clinically effective, but also managing those costs responsibly for members. And then now with this partnership, we're adding in a whole nother layer that I think is very important,
Mhm.
with that, especially with chronic disease state management, not just chronic disease, but, it could be acute too, but specifically with these things like diabetes that we know are costing plans so much money.
Mhm.
There's really not as much we can, like, we're kind of at the point where we've done everything we can. We need to layer in this preventative care piece. And I think
Mhm.
that's where your program fits in so nicely.
I am truly excited because we've been working with chronic disease management since the beginning, right? I started in the hospital at 16 years old, pushing out tray carts in the hospital and seeing how, type 2 diabetes really affects the entire body and understanding that nutrition can truly play a role when we talk about blood pressure and cholesterol and all these different chronic diseases that we have today. So, this partnership for me means a lot because we're able to go into a work site and say, okay, this is what's going on with you. You have this many employees are taking type 2 if I can talk, medications. These are who's taking the GLP-1s. This is where we are with high blood pressure. We're able to implement these nutrition programs to see people actually get healthier. And if we have healthier employees, we're going to have more productivity at work. We're going to have better mental health at work. So that's where it's really cool for me I never was able to have this side, to have this much data to work with you guys to show the employer of what we can do. So that's where like my excitement comes in of being able to show this.
Yeah, and it's a different perspective from a PBM standpoint. I think in our side
Hmm.
is that the PBMs, they have a bad reputation in the industry, and it's been well deserved, no transparency into what the drug pricing is, right? Maybe approving more prior authorizations than they should. We're seeing that in the GLP-1 world right now, that so many people
Hmm.
are taking that maybe shouldn't be taking it, or maybe a smaller dose, or need some sort of program like Kelly's Choice to put it in place, right? So for us as a PBM, we want to lower claims, which really takes money out of our pockets. It's really kind of a taboo thing
Yeah,
for a PBM to
counterintuitive.
do.
Yeah.
Yeah, that's exactly it. And a lot of our competitors that have programs that would kind of sound like a wellness program, it's
Hmm.
not a nutrition dietitian program. It's not talking about, let's get to the root cause. Why do you have inflammation? Why are you
Right.
overweight? Why is your blood pressure high? Why are these things happening?
Hmm.
And lowering claims, getting people healthier is not something that a PBM typically does. And, you're not a prescriber, you're not prescribing
Hmm.
GLP-1s. As a pharmacy benefit manager, a lot of PBMs own pharmacies, which is a conflict of interest. And we don't have that. So we really just, our incentive here is aligned with yours and the employer to make sure that our members are getting healthier and lowering the cost for the employers.
It's amazing. First time. And that's
Yeah.
where I think exposing this and this relationship is just such a cool, cool thing that we're doing together. So, what is your day to day like? And what are you doing on the back end?
Yeah.
So, I'm so curious as well.
It's a lot. It's a lot of different things. Right now, obviously, the GLP-1s, that class of medications is
Hmm.
such a big conversation. You mentioned it. It's uh, clients are coming to us and saying, like, what do we do here? How the utilization is increasing. They're getting more expensive. So we're looking at strategies like Kelly's Choice, among other
Hmm.
things, to help control that spend. We're talking with members too to walk them through that process of my doctor prescribed this. What's next for me? You mentioned prior authorizations. So it's not about blocking care. It's just about making sure that the right medications are with the right patients at the right time. So we do review those prior authorizations to make sure that the medications are being prescribed for what they were intended to be used for. So GLPs traditionally, they've been initially used for type 2 diabetes and obesity. So right now our criteria looks like if you're prescribed Ozempic or Mounjaro, we're making sure that you're using it for type 2 diabetes to help manage that cost for employers.
Hmm. Really interesting of that day to day. And
Mhm.
Hannah, what are you doing? You're getting out in the field, right?
So I'm on the field. I'm meeting with insurance brokers, our clients, TPAs, different partners of ours, and
Hmm.
really trying to educate them on what makes Verus different as a PBM. Partnering with Kelly's Choice is one of those differentiators. But as a PBM in our Verus Path program, which really makes us stand out, that's where we're looking at cost containment solutions ahead of time, right?
Cool.
So our industry often says that there's a member at the end of every claim, but there isn't a claim without the member. So Verus has really reversed that by saying it starts with a member. The claim is there because of the member, right?
Hmm.
So if you flip it and that's your mindset, you're able to do that proactive work. That is what Verus is doing, right? So
Hmm.
when someone is going to the doctor and they're getting diagnosed with an illness, and taking a high cost specialty medication that they've never heard of, it's costing,
Right.
tens or hundreds of thousands of
Yeah.
dollars. That's the time, that's the opportunity to engage with those members, to show them empathy because they've just been diagnosed with a life changing illness or disease that,
Right.
again, like I said before, it's not curable. Maybe these medications are really there to manage that disease for that member. So if we can catch them when they get diagnosed, when that
Hmm.
first claim, that first medication is processed, then we can engage with them and talk to them. Hey, we're Verus, we're your PBM, and we have these cost saving solutions in place where our members are completely minimizing their financial out of pocket to zero or minimizing it to something less than what they were paying before. And then the employer is seeing a benefit of sometimes 50 to 75% savings. And it makes the member feel more comfortable. They're an educated consumer, and we're not catching them after the opportunity is there, right? After it's too late, after they've paid out of pocket.
Mhm.
Because a lot of the time, what we hear is that these members are saying, well, this week it was between getting my medication or getting gas or groceries.
Terrible.
So if we can catch them beforehand,
Mhm.
we can move the needle for everybody, and everybody's incentives are aligned to for us to be successful, for the member to get their medication, and the plan to save money as well.
Something you said too, I want to touch on is you said when they get that diagnosis and they get that prescription, that's when we usually identify them.
Mhm.
Right now, 1 in 3 Americans has prediabetes. For prediabetes, that's they're at risk of progressing into type 2 diabetes.
Mhm.
You're probably not going to see many claims for someone with prediabetes. Many patients don't even know they have it, right, until they go to the
Right.
doctor. So I think that's why stepping back, even from that, where they're trying to manage their medications, but if we could get these people to not even have to start those medications in the first place and bring in your program to help educate them. And if they're at that pre-diabetes stage, if we could keep them there or even reduce them and not ever progress or even delay that progression, that's fantastic. That's what this is all about.
That's what I do. So I'll talk about the program of what we're bringing to light. So about 12 years ago, we partnered with Healthy. It is a HIPAA compliant app that you can get from an invitation from Kelly's Choice. So it is HIPAA compliant, but it also can track everything from your food and exercise. And it does really fun integrations with like Dexcom and Apple Watch. So it's basically a little gamification, but also it has the education built in. So on the platform, you have self-directed learning in the way of nutrition. There's exercise, recipes that everybody loves. And every single week, there's going to be a new education platform sent to them. And it goes to their email so that they're reminded to get back to the app. So there's little hints of like, what is kefir and how does that work in your body? And then a recipe that goes along with it. So there's always little pieces of information. And then we're going one step above with chronic disease management, where we actually created a program called the Transformation Program. And it's basically our Kelly's Choice method of working with chronic disease. And over these past 13 years of being in business, we've been able to reverse type 2 diabetes, high cholesterol, high blood pressure, and chronic inflammation. And it's been incredible to see both on the private practice side and in workplace wellness with this platform that we truly can take people through an education journey, and there's behavior change every single week. So every week they get an exercise, nutrition, and hydration challenge where they're able to go into the app and track those things. And it's just amazing of what we can see and how we can reverse these chronic conditions. So most of the physicians that are out there have only had about one course of nutrition their whole stint. And I can say that because my husband is a doctor and I have a stepdaughter going now into medical as well. And unfortunately, physicians are not educated on how to reverse, and they've been taught just to give medication. So it's our job to say, hey, you actually have the power with education to make the right choice. Hence Kelly's Choice. Nutrition is a choice. And so when you're in the grocery store, you're going to be more likely to make that better choice if you're educated on why.
I agree with you. We've been going through your modules as an organization. So Kaylen has done it, I've done it, and the broader team. And it's so nice to be able to find the things that work for you, because I've learned
Mhm.
about
Yeah.
carbohydrates, sugars, fruits, vegetables, exercise, just like things that work for me. And
Mhm.
so I've really loved going through the process. And then there were things that resonated more, like sugars. I'm a foodie. I love cookies. But I've been able to go in and be able to
Mhm.
log my foods,
Right.
track my exercise, my activity, to make sure that, I am walking, that I am moving around,
Mhm.
doing the things that I should, and then using the fun recipes at home. I've done it with my family, I've done it with my husband, and it's just a nice reminder from you, because you are so engaged with us as a team,
Yeah.
to keep it going, stay consistent. And I think that's what we found is the difference with Kelly's Choice is the consistency piece, because there's so much in our world of like technology or wellness requirements and things that aren't as engaging, like one on one, person to person. And so, what our groups see at Verus is they know Kelly, they know Claire, right? They know your team of your
Yeah.
dietitians, they understand your processes well enough. And so, it feels different, and you feel the commitment on both sides, which is nice.
Well, thank you, Hannah. And our tagline for 13 years has been real people promoting real food. And I think that there's a lot of wellness products out there, but if you lift up to the hood, you're just seeing AI, you're just
Mhm.
seeing, different things. We are real people. We're real dietitians with expertise in nutrition and in the way of exercise and hydration and all of that as well. So I feel like that's what sets us apart. And thank you for recognizing that, because you do have that real touch. Every single month, we do live sessions with a dietitian, and it's amazing to see the question and answer afterwards of what people are interested in nutrition and all the questions that come out. It's confusing time, right? There's a lot on social media. What do I do? What do I not do?
Yeah.
And so if we can break it all down and make it easy for people, so thank you for understanding what we do and how we make it different.
And teaching us how to read labels. That was something, it is confusing.
Yeah.
I
Yes.
think I might be making a good choice, but am I? There's a lot
Mhm.
of the packaging, the front of it sometimes gets a little bit, misleading.
I agree with you. The label is
Mhm.
interesting, and also trends. So
Mhm.
right now you'll see just like protein slapped on all
Yep.
these different the front of the packaging, and you're like, okay, like Pop Tarts with protein, are they better for me? No. Like, but that's where we'll help you to be a smart consumer,
Yeah.
so that when you do
Mhm.
get to the store, you're able to understand that. And I think it does have the ripple effect that goes to the children as well. And as you were talking
Mhm.
about, now it's 1 in 3 children, 12 to 17, either have
Yep.
pre-diabetes or diabetes. And so, again, if we can teach the employee and have that go home, that we're really truly affecting chronic disease long term.
Yeah.
Yeah, absolutely. And in reality, without intervention, it's going to be type 2 diabetes. So, do you want to go ahead and act now or be on the medication later? Sometimes it's both,
Hmm.
and that's fine. We're not saying that medications are bad, they're very effective for
Correct.
a lot of people.
Yeah.
But I think it's that multidisciplinary approach that is
Yes.
so important. So, take the medications, and Verus will continue to help manage those medications for members. But we're just wanting to add in that nutrition
Yep.
education that I don't think many people have had access to.
No.
No.
It's not being taught in schools. We're trying to push in and do that this year. We're doing a lot of education that way. But in most school districts across the US, this is not something that's being taught.
Mhm.
And hopefully that does change over the next decade. But it is something that we need to get out to the employees. I think that this is the moment to, get that information out.
Mhm.
So I want to dive in a little bit into GLP-1s, because I started in bariatrics back when I was 21 years old. And at that time, we saw people the day before surgery. And we went through this giant list. It was like actually a 3-page packet of all the things they couldn't have after the surgery. And people would sit and look at me and go, what? And then I came back 10 years later, and we had centers of care, and we had dietitians seeing the people at least 4 times prior to the surgery, and we implemented nutrition education throughout their journey. And I really see with GLP-1s that, again, it was like the Wild West, where people were getting these medications, there's compounds and things like that. And what I would love to see is what we're doing here in this partnership, where people are still educated, even if they're taking the GLP-1s, because there could be major nutrient deficiencies. And we saw that with bariatrics. Like, if people weren't educated on how much protein or B12 what they needed to be taking, they could really become deficient. And I think this partnership is really amazing as well, because we're getting nutrition education to people that are either wanting to take GLP-1s or on them, so that we don't see hair loss, muscle wasting, and deficiencies. So talk about that a
Mhm.
little bit. I think it's
Absolutely.
interesting time.
It is. It is. And, I think it's important to say that these aren't new drugs. Like, as a whole, we think they are because the media's, gotten a hold of them and we're hearing so much more about them. But they've been around for many years to be used for type 2 diabetes. But now that they're being approved for indications like weight loss or chronic obesity, there's new indications now for obstructive sleep apnea, for cardiovascular risk management, for fatty liver disease. So we're going to keep seeing them prescribed. And I know that there's going to be new indications released. There's going to be new medications released. So they're not new, but they've gained so much popularity. The drugs are much more effective. The newer ones are. They're being used for more things. And like you said, it's fine to take them. They're great. They have a place in therapy, but there's side effects. And a lot of those side effects can be mediated by what you're eating and your other lifestyle. So muscle wasting, you touched on. So making sure protein's in there. I don't know that everybody necessarily knows what that looks like. Like you said, you might go to the grocery store and say, oh, well, that has protein on it. I'm gonna eat a protein Pop-Tart, like I'm good. But having
Right.
somebody come in and teach you, I know the physicians aren't always like, they don't always have time to sit
They
down and
don't.
go through
Right.
and like even work with, I know you mentioned that you might work with like cultural differences. So what is already in
Mhm.
your diet, what work within those limitations.
Mhm.
Um, so the muscle wasting, the hydration, a
Yeah.
lot of it is people, they're getting dehydrated because they're not, getting the fluid intake that
Mhm.
they should on these, which leads to headaches, which in turn leads to more medications prescribed, which increases drug spend even more. Um,
Constipation, there's
yep,
now a drug for that,
absolutely.
right? So
Yeah.
it does compound.
Hmm.
And I think that having this nutrition integration with any medication you may
Hmm.
be taking can be so much more effective and
Sure.
helpful.
And, maybe someone doesn't want to be on it long term.
Right.
Maybe they need it now to meet them where they're at and, kickstart. But
Mhm.
without those lifestyle changes, when you stop it, it's going to, the effects are not going to be there anymore unless you have implemented these changes behind the scenes. So
Correct.
I think our motto here would be that we're going to continue managing that for you. You will be, allowed to have them. It's not about restricting care, but I
Right.
think it's about the opposite. So you're broadening care, you're widening that care to include these
Mhm.
other changes.
I agree. I completely agree. So it's Hannah and I just talked to a business owner just the other day and exposing of what's going on with her organization. So do you want to talk about that a little bit? And we won't mention names, but I think
Yeah.
this is a great example of what we're going to be able to do together and
Yeah.
how impactful it will be.
Yeah, I mean, to what you guys say leading into this, that's kind of the beauty of our program together. It's so flexible, like what we do at Verus, really tying into kind of our motto, who we are, is you can put on Kelly's Choice if you are covering GLP-1s, right? She can work alongside your members. If you don't want to cover GLP-1s and you want this to be your option, Kelly's there. So you can have that piece of flexibility because a lot of plan sponsors, the employers, they don't understand that they are covering GLP-1s, even though they don't think they are, right? Because they are getting approved by these large insurance companies, and nobody's looking at the notes on a granular level to see if they really should be taking that medication. Maybe it's someone that just wants to lose 5 or 6 pounds. And what we hear a lot of the time is, I can't get off the GLP-1 now. I can't. Like I've been on it so long and as good as they can be, there are side effects. There's Ozempic teeth. There are, you can have, different mental health issues relative to it, right? Body dysmorphia, suicidal ideation. There are a lot of things that, are a side effect of these GLP-1s as great as they can be. So when you tie in that nutrition piece, it can be a way to continuously manage it or wean yourself off of those GLP-1s. Because what I've heard and my friends and family is I want to get off of it, but I can't because I'm going to gain all the weight back. But to the employer group that we met with the other day, they don't know if they're covering them or not. There are tons of people in the organization that are on them because you're working with them currently, working with those GLP-1 members, but they don't have a plan. There's no, what's the end of this? Like, what's going to happen 2, 3 years from now, right? And so that's where they're bringing in Verus, bringing in Kelly's Choice to say, we need to plan for the future. We need to tackle this problem today and plan for the future because this company is so invested in their members being healthy, right? Empowering them. They want them to show up to work. They want them to be healthy and happy and grow in their careers and grow in life. And so she's like, I don't know what to do here, right? Like, we got to figure out something because if the GLP-1s are working, let's keep it going, but let's involve Kelly, right? They're kind of in a predicament. And that's the piece where employers need to understand their data. They own it when they're a
Right.
self-funded health plan and they use it to say, hey, we do have a really high GLP-1 utilization. We need a Kelly's Choice in place.
Mhm.
But we've also identified so many other cases, even though that's the elephant in the room is the GLP-1s. We've identified cases where you can help with members' children that have long-term illnesses or
Right.
disease states. You've been able to help ESRD members. So there's so much more beyond that, but because that's kind of the, thing that everyone's talking about in insurance these days, that is what it is. But there's so much more value in what you can offer beyond the GLP-1s
Yeah.
that I think is really interesting. And as we've gathered data together and we've kind of combined everything, it's worked out really well to be able to identify where we've had our successes. And they've not only just been in the GLP-1s.
I'm so glad you brought that up because a big one is mental health. We know that it's a very large number of people that are taking anti-anxiety, antidepressant medication. And before this moment, people didn't realize the connection between nutrition and mental health. And over the past couple of decades, we've gained so much research of understanding the microgut biome and how nutrition plays a huge role in that. Fiber-rich sources, vitamin D, how it actually creates that mucosa layer where the gut biome lives, and how by eating these types of foods, we can create serotonin, which goes right through our central nervous system. So when we talk about, like you said, GLP-1s are the big elephant, but we really are looking at mental health. And we can't just say we're dealing with mental health without having a nutrition program in place. So this is where, again, with chronic disease management, mental health, the GLP-1s, really all of it kind of comes together. And we're seeing this for the first time coming together. So I'm really glad that you brought that up because so many people could be helped no matter where they are in life.
Yeah, I agree. And it's nice being partnered together, having that data connection or integration,
Mhm.
you call it. And so when someone is a client of Verus and they have Kelly's Choice in place, we're helping with that communication piece. You're getting those members information, you're able to outreach to them, get them enrolled in
Mhm.
the program, continuously keep them engaged
Mhm.
like you have with the team at Verus. We pilot it in-house and it's been great for us, but it really works out that you don't have to go a million places, right? Insurance can be so tricky. There's an app here, there's this, that. We're
Mhm.
really combining everything,
Things
saying,
together.
hey, we're pharmacy benefits is at the core right next to medical, and integrating nutrition can help with everything, the full picture of really getting to the root cause and making members healthier.
Yeah, and we'll be able to look at claims too because we're
Correct.
integrated, our systems
Right.
are working together. We'll be able to look at, the mental health claims, your diabetes, your high blood pressure, high cholesterol. I think we're even looking at pain management. So if you
Mhm.
lose weight, then it's better on your joints.
Mhm.
So we'll have all of that data and we can pull
Yeah.
that for any individual group to show what their current spend is. And then our hope would be that once they integrate a program like this, that even if it doesn't maybe get people off medications, you are preventing those new starts. So they're starting
Absolutely.
with those changes first before jumping right to the medication.
Absolutely. And I am a business owner. So that's where when I sit down with business owners, I'm like, don't you want to know? Like,
Mhm.
you should be knowing this information. And also how, we can potentially, like you said, save quite a lot of money.
Mhm.
So again, I think this is going to be an incredible partnership. It already has been. And thank you, ladies, for the
Yeah.
opportunity.
Yes.
So
Absolutely. We're
I
excited.
hope that everyone watching, if you are a business owner, if you're thinking about
Mm.
any medications, look up these companies, look to see what we're doing. We will, like Hannah and I will get on the road.
Yeah,
We
so
will
easy to
be at your
integrate it. We've
office.
made it as seamless as possible for
We
our
will
current
work with
clients,
you.
for our future clients. Like,
Yeah.
Yes.
it's all ready.
So definitely look us up and thank you for sharing your time.
Thank
Absolutely.
you.
Thank you, Kelly.